Assalamu alaikum friends, my name is OMAMA SHAH and today we will be studying the pathology. First we will introduce the pathology, what a pathology is, then we will study some terms regarding the pathology, and at the last we will study the branches of pathology. So let's start. The word pathology is derived from two words. Patho means suffering, while logy means study. So in pathology, we study the suffering, such that the body suffers from a disease. So the scientific study of a disease is called as pathology. In pathology, we basically investigate and understand that what the suffering is due to, means what factors causes this suffering. So the first main thing is we study the cause. What causes the disease? What causes the suffering? And the other is that if there occurs a disease or a suffering, what changes occurs at the level of cell, tissue and organ. So friends, now coming towards some basic terms and pathology, in which first we have etiology, which is the study of the cause of a disease. In etiology, our main concern will be the cause, the factors that causes the disease. The factors may be bacteria, viruses, microorganisms or other substances that causes the disease. The second terminology is the pathogenesis. What we do in pathogenesis? In pathogenesis, we basically study the mechanism by which a disease develops, such that when a person is infected by bacteria or viruses, they occupy different mechanism in order to develop and progress. So from the initial to the final conclusion, which may be either recovery or it may be either death, the mechanism by which they develops and progresses comes in the category of pathogenesis. So friends, now we are going to discuss two important terms, and that is very much essential for your medical field. One is the prognosis and the other is the diagnosis. Now it is necessary that you should know what the prognosis and diagnosis is if you are in a medical field, and what's the difference between the two. So if we talk about first the diagnosis, so if you identify a disease or you determine a disease through clinical examination, or you by checking medical history of the patient, or by seeing to the sign and symptoms of the patient, which comes in the category of clinical examination, so that identification and determination is called as the diagnosis. Now this diagnosis is then followed by the prognosis. Now what the prognosis is? The prognosis is when you predict that how quickly will the disease recover, or it will worsen, will it improve or not, what the patient condition will be in the future. So the main difference between the diagnosis and the prognosis is that the diagnosis concern the present condition of the patient, while the prognosis concern what the patient condition will be after the disease. So this is the main difference. The diagnosis tells us about the current condition of the patient, while the prognosis tells us that what the patient condition will be in the future. And the prognosis is done through knowledge or experience, while diagnosis is done by medical examination through some test performed and that was all about the prognosis and that diagnosis. So friends, we have the next is the mortality. The mortality is basically when you count the number of deaths in a particular group of people. The other is the morbidity, which is the count of the disease in a particular group of people. And the other is the biopsy. The biopsy is basically when you remove a tissue in order to examine it for a particular disease. So that removal of tissue for the examination of a particular disease, that if the disease is present in the tissue or not, is called as the biopsy. Now we are going to discuss what a disease is. A disease is basically a state or condition of a body in which an individual different parts deviate from its normal structure and function. Now let's discuss the classification of a disease. First, you can see over here is the inflammatory disease. In inflammatory disease, the tissue is inflamed by the attack of body's own immune system. Examples include allergy, asthma, tuberculosis, appendicitis, etc. The other is the degenerative disease. In degenerative disease, the tissue deteriorates or loses its functional ability due to traumatic injury or aging. It is important to note that aging is the main factor in degenerative diseases. Examples include osteoarthritis, osteoporosis, and Alzheimer's disease. The degenerative disease worsens over time, such that as time passes, the disease worsens. Neoplastic disease. In neoplastic disease, there is a formation of a tumor. The tumor, which is an abnormal mass of cell growth, may be benign or malignant. Benign means non-cancerous, while malignant means cancerous. It is important to note that all kinds of cancers fall in this category. The last one is the traumatic disease. The traumatic disease include group of emotional and behavioral problems that may be due to exposure to physical or emotional violence or pain. Examples include fracture of bone or trauma to the brain. Now let's discuss the types of disease. Number first is the acute. The acute disease occurs suddenly and lasts for a short duration of time. For example, heart attack, burns, injuries, asthma attack. Number second is the chronic. The chronic disease develops gradually or remains for a longer time. For example, influenza virus, common cold. Idiopathic disease. In idiopathic disease, we don't know about the cause, such that the cause is unknown. Teratogenic disease. In teratogenic disease, the drugs crosses the placenta barrier and harm the fetus. Contagious disease. The diseases that are transmitted through contact with the skin are the contagious diseases, while the diseases that are transmitted through sexual contact are called as venereal diseases. Infectious diseases are caused by pathogenic microorganisms, while communicable diseases are the diseases that are transmitted by the agents fomites and vectors. The fomites are non-living objects or materials that carry the infection, while vector are the living creatures, for example mosquito, that carry malaria. Now coming towards our last topic of discussion, which is the branches of pathology. Number first branch is the general pathology. As the name general indicates, that it will be applied to all organs and tissues of the body. So in general pathology, we study the alteration or changes that occurs in almost all organs and tissues of the body. For example, atrophy, which is the shrinkage of cell, necrosis, which is cell death, or an inflammation. Surgical pathology. In surgical pathology, we remove a tissue during a surgical operation and examine it for a particular kind of disease. In chemical pathology, we study the alteration that occurs in the chemicals of the body as a result of a particular kind of disease. In clinical pathology, we diagnose a disease by examination of bodily fluids, for example, blood, urine, etc. In geographical pathology, we compare the disease rates and risk of individuals in different areas of the world. In systemic pathology, we study the diseases that arises in the organ system of the body, for example, nervous system, circulatory system, digestive system, etc. In gross pathology, we study the disease in a tissue or examine a tissue without the aid of a microscope. While in cellular pathology, we examine a tissue with the aid of a microscope. In immune pathology, we study the diseases or defects that arises as consequence of the immune system. In physiological pathology, we study the functions of different organs in which there is a defect. Now coming towards the key points. Etiology refers to why a disease arises, and pathogenesis describes how a disease develops. In short, in etiology, we study the cause of a disease, while in pathogenesis, we study the mechanism by which the disease develops. The word gross describes the way tissue looks when examined without the help of a microscope. Fomites are objects or materials which are likely to carry infection, such that furniture, clothes, and utensils. The disease in which tissue deteriorates and loses its functional ability with time is known as degenerative disease. Thanks for watching. Allah Hafiz for now.